And next, we're going to go to the gentleman from Georgia, Mr. Bishop.
Thank you very much, Mr. Chairman. I'd like to thank you, Chairman Pallone and Ranking Member Walden, and the members of the House Energy and Commerce Subcommittee on Health for giving me the opportunity to testify this morning on an issue of great importance to the delivery of health care, especially in rural communities across the nation. The issue is non-emergency medical transportation, or NEMT, which currently provides Medicaid beneficiaries with rides to medical appointments every year. This benefit, which has been in place since Medicaid's inception in 1966, has come under attack recently by the Centers for Medicare and Medicaid Services, which has sought to roll it back by making it optional at the state level. Such a change would have wreaked havoc on millions of Americans' ability to get to and from their medical appointments quickly and, most importantly, safely. Individuals who bear the highest burden of chronic conditions, including cancer, HIV, substance abuse disorder, and end-stage renal disease, would not have been able to access vital medical services like chemotherapy, physical therapy, and dialysis. They also would not have been able to travel to pharmacies to obtain their prescription drugs or their medical supplies. In Georgia alone, non-emergency medical transportation provided patients transportation nearly 60,000 times last year to pharmacies to pick up prescriptions that are important for their adherence to a plan of care. Ending Medicaid coverage for non-emergency medical transportation would literally have been a matter of life and death for many of these individuals. Earlier this year, I sent a letter to Representative Rosa DeLauro, who chairs the House Appropriations Subcommittee on Labor, Health, and Human Services, Education, and Related Agencies, as well as to Ranking Member Tom Cole, opposing this change. Our letter requested legislative language in the appropriations bill blocking funding for the implementation of that rule change. It was signed by the entire Congressional Black Caucus in the House and received important bipartisan support from a number of my Republican colleagues in the House. I'd like to ask unanimous consent that that letter be included in the record with my testimony.
Without objection, so ordered.
56 non-emergency medical transportation stakeholders, including groups representing Medicaid beneficiaries with substance user disorder, behavioral disorders, and end-stage renal disease, also sent a letter opposing the rule change. I'd like to ask unanimous consent that the list of those people be included in the record also. I'm pleased to report that the language was successfully added to the FY 2020 Labor HHS Appropriations Bill in an amendment that was offered as a manager's amendment by Chairwoman DeLauro. Following its inclusion in the bill, we heard word from CMS that they won't try to promulgate the rule until after the 2020 elections. Although this is welcome news, we still have to be vigilant and ensure that this important benefit remains available to our most vulnerable citizens. Yesterday, I joined my colleagues Tony Cardenas, Tom Graves, and Buddy Carter in introducing bipartisan legislation that would codify the Title 19 of the Social Security Act, the Medicaid Transportation Benefit. The bill, H.R. 3935, would simply preserve the status quo. It would add non-emergency medical transportation services for individuals without other means of transportation to the list of mandatory benefits that every state Medicaid program is required to provide by law. According to CBO, the bill would have no cost provided that we act before CMS publishes the proposed rule. I'm hopeful that the legislation will be considered quickly by the subcommittee for inclusion in an extenders package by the end of the year. In the coming weeks, we plan on introducing legislation on the Medicare front as well. The legislation will provide coverage for non-emergency medical transportation for patients who qualify for Medicare based on their end-stage renal disease. The measure is being finalized as we speak, but the details are still being worked out. I was inspired to work on this issue by a staff member in my Albany, Georgia office whose daughter had end-stage renal disease and subsequently had a successful kidney transplant in 2015. Look forward to working with all of you in the days, weeks, and months ahead to ensure that these important transportation services are protected now and into the future. So I thank you for allowing me to appear before you this morning.
I thank the gentleman. So you want us to look into a permanent fix, basically?
Yes.
All right, we'll certainly look into it. Thanks a lot. Thanks.